Hello everyone. In this video, I'll give you a brief introduction to pneumonia. Which is a very common condition, particularly in winter and in a number of cases in the community or in the hospital. It is an inflammation of the lung parenchyma, which is caused by various microorganisms like bacteria, mycobacteria, fungi, and viruses. And pneumonitis is a more general term that describes the inflammatory process in the lung. If we look at the classification, it is the CAP or community-acquired pneumonia, hospital-acquired, pneumonia in the immunocompromised host, and aspiration pneumonia. Here, I have shown you 4 X-rays which compares there is a comparison between the picture of a normal lung. The second one, B, is the bacterial pneumonia affected lung. The third picture is that of a viral pneumonia affected lung. And in the present day situation, COVID-19 affected lungs, which is very, very common in the pandemic situation. The community-acquired pneumonia either occurs in the community setting or within the first 48 hours after hospitalization. And it is caused by Streptococcus pneumoniae, H. influenza, and Pseudomonas. So only 50% of the cases does the specific etiological agent become identified. And it is the most common cause in people younger than 60 years of age, and viruses are the most common cause of pneumonia in infants and children. Second one is the hospital-acquired pneumonia. It occurs or the symptoms of pneumonia occur after the patient stays in the hospital for more than 48 hours after admission, and there is no evidence of infection at the time of admission. And it is the most lethal nosocomial infection and the leading cause of death in patients with such infections. The usual presentation of hospital-acquired pneumonia is a new pulmonary infiltrate on X-ray, which is combined with the evidence of infection. Aspiration pneumonia, it refers to the pulmonary consequences resulting from the entry of endogenous or exogenous substance into the lower airway. And the most common cause is the bacterial infection, which occurs from the aspiration of bacteria. And it may occur in the community or hospital setting due to Streptococcus pneumoniae, H. influenza, and so on. Hospital-acquired pneumonia, the causes could be Staphylococcus aureus, impaired host defenses, comorbid conditions, which I'll discuss even in the risk factors. Supine positioning. So when the patient stays in a prolonged supine position, fluid in the lung pools down and stays stagnant, making it a breeding place for bacteria. So in prolonged hospitalization, again, the risk factor here is the nosocomial infections. Viral pneumonia is caused due to influenza virus, RSV, rhinovirus, which causes common cold, human parainfluenza virus, human metapneumovirus, measles, chickenpox. Continued with it, again, adenovirus infection, coronavirus infection, SARS-CoV-2 infection, the virus that causes COVID-19. Although the symptom of viral and bacterial pneumonia are similar, viral pneumonia is usually milder. It can improve in 1 to 3 weeks without treatment. According to the National Heart, Lung and Blood Institute, a trusted source, people with viral pneumonia are at risk of developing bacterial pneumonia. Another common cause which I listed is the fungal infection. So fungi from soil or bird droppings can cause pneumonia. They most often cause pneumonia in people with weakened immune systems. Examples are pneumocystitis, xerovesi, Cryptococcus species, and histoplasmosis species. I have listed a few risk factors which are very important for a nurse to know. Anyone can get pneumonia, but certain groups do have a higher risk, which include infants from birth to 2 years old, people aged 65 and older, people with weakened immune systems due to pregnancy, HIV, the use of certain medications such as steroids or certain cancer drugs. People with certain chronic medical conditions such as asthma, cystic fibrosis, diabetes, COPD, heart failure, sickle cell disease, liver disease, kidney disease. People who have been recently or currently hospitalized, particularly if they were or are on a ventilator. People who had a brain disorder which can affect the ability to swallow or cough, such as stroke, head injury, dementia, Parkinson's disease. People who have been regularly exposed to lung irritants such as air pollution and toxic fumes, especially on the job. People who live in a crowded living environment such as a prison, people who smoke, which makes it more difficult for the body to get rid of mucus in the airways. People who use drugs or drink heavy amounts of alcohol, which weakens the immune system and increases the odds of inhaling saliva or vomit into the lungs due to sedation. Thank you. And the further discussion of pneumonia, like management, I'll be talking to you in my next videos. Thank you so much.